using our necks at an awkward position, bending like this. So that adds strain to the ligaments and the joints in the neck and the muscles. That causes pain. Not only for the neck, the same thing applies for the back as well. Ergonomics is also coming up in a big way, especially in corporate culture nowadays. Everybody's paying importance to ergonomics. That is, whenever you're sitting in front of a system, you should make sure that you have a proper desk and chair.
And how fast or soon the patient can recover after the surgery?
Somebody is actually knows swimming is one of the best exercises for the spine. Every half an hour, 45 minutes, just get up, walk around, come back, or change your posture, even while you're sitting, even if you have a meeting for long hours.
According to a report by WHO, nearly 80% of people across the world suffer from some or the other back pain or back issues because of their sedentary lifestyle. And the worrying part is that the average age of this suffering has reduced dramatically. What should be done? What are the common causes? What are the reasons behind it? We will be discussing that in this video with Dr. Akshay Hari. Thank you so much, sir, for coming here. First, sir, doctor, tell us about your journey getting into this field, the expertise of neurosurgery or back pain or spine pain.
So thanks a lot, Anupam. So I'm glad to be on the show. So it's as you probably know, it's being a doctor is you spend a lot of years studying and being a neurosurgeon. Of course, it just adds more to the years of experience. So I landed up in neurosurgery primarily because of my mother. There's probably a little bit of an emotional connect there. I always wanted to be a neurosurgeon. My mother, she wanted me to be a doctor, but she had a medical condition. She had a neurological condition. She passed away early in her probably in her 30s. So ever since then, I just I decided I wanted to be a surgeon, and then neurosurgery just became my automatic choice. So, and right from my early days of neurosurgery, and right from my residency, I was exposed to a lot of, spine surgery, being early in the practice. So, and at the same time, it was all exposure to minimally invasive spine surgery. So then that's the natural, so probably life just took its turn towards spine and spine surgery. So that's where I am today. After all these years, I've done my training, especially in minimally invasive spine surgery. I studied abroad. Did my fellowship in Australia. I also trained at various other centers in the US and Europe. So, and here I am now at Aster.
Thank you so much, doctor, for that inspiring story. And also coming back to India and helping a lot of people with your knowledge. That is very much important. Let's talk about the common reasons. I mean, you being young yourself, I find that one of the reasons for back pain is the continuous mobile social media use in our hands. What are the other reasons commonly you find out with back pain or spinal injuries?
So back pain is basically very, very common nowadays. In fact, studies have shown that it's one of the second most common condition for any doctor visit, second only to common cold. So it's that common basically. And this back pain, which was earlier a condition which was only seen in the elderly or people above 50 or 40, is nowadays seen much earlier in people in younger age, as you also mentioned. So nowadays the lifestyle is one of the major, I would say, the reason for this kind of conditions being seen in much younger people. So as you said, social media is probably one of the biggest culprits. Our mobile phones, our technology these days, we are constantly on, basically using the screens, whether it's a computer, whether it's the phone, whether it's a laptop or your tab. We are always cranking our necks, sitting in awkward positions, and that I think is one of the most important reasons for this kind of a shift in this cultural shift in seeing these kind of conditions at a younger age. In fact, we even have a technical word for it. It's called the tech neck syndrome. So that means whenever we are constantly using our phone or staring at any screen, using our necks at an awkward position, bending like this, so that adds strain to the ligaments and the joints in the neck and the muscles. So that causes pain. Not only for the neck, the same thing applies for the back as well. And I think that's one of the major reasons for seeing back pain at a younger age nowadays.
Talking about social media, I think you are one of them who uses it. You are young yourself. I am young. We use it. And we have this sedentary lifestyle inculcated every day in our life. We want that laziness to be there around somewhere. So what are the precautions people should take? Because we have lifestyle which balances both a sedentary lifestyle and a very active lifestyle. But what should we do to avoid the sedentary part?
So I think you've just hit the nail on the spot, saying that the good balance is very important. Yes, you're absolutely right. Social media is here to stay, and our lifestyle is also not going to change. Probably even going to get worse in the next coming years, and especially the newer generation. But yes, how do we avoid this? So a perfect balance of having that sedentary lifestyle and mixing it with activities. So I would say, three things are very important as far as, while you're working. It doesn't really have to be just social media. It's, whether you're working, you have a desk job, you're sitting, you're working from home, or even, working, like me, I stand for long hours, and, people who are just sitting. So what we should remember is that every now and then, number one, we should sit in a good posture. A good posture, these kind of things take you a long way. Ergonomics is also coming up in a big way, especially in corporate culture nowadays. Everybody's paying importance to ergonomics. That is, whenever you're sitting in front of a system, you should make sure that you have a proper desk and chair. You should make sure that your back is supported at all times. That is, I think, number one. Second thing is frequent change of posture. Every half an hour, 45 minutes, just get up, walk around, come back, or change your posture. Even while you're sitting, even if you have a meeting for long hours or something like that, make sure that you're just shuffling a bit, not sitting in the same posture for a long time. And the third thing is exercise. So big, I think that it goes a long way in saying that, exercise is very, very important for maintaining good spinal health, because your core muscles, that is the muscles which are surrounding the spine, whether it's your abdominal muscles or spinal muscles, these are called the core muscles. Good strengthening of core muscles is very, very important. So there's even a saying nowadays that sitting is the new smoking. So basically, it's so bad. So we should remember to be active all the time.
Okay, so doctor, since you're talking about exercises, I myself have been going to the gym since 15 years, but I see people over there who are overdoing the exercise and it becomes counterproductive for them. And also, what exercises specifically you would suggest for the people who are not regular to the gym or not into regular exercises?
Absolutely. I think that's a very good question. We don't have time basically nowadays. So, but somehow we should include, like I said, exercise as part of our daily activities. So simple things like walking, maybe a half an hour, 20 minutes of walking every day is one of the best exercises that we can do, which is simple to do and easy to do. And we can easily inculcate in our daily lives. But if you talk about specific back exercises, maybe lying down exercises are actually very good for starters.
Oh, you mean sleeping? I do that.
Exercises which are, when you're done, basically with you're keeping your back at rest. Especially if you're standing and doing exercises, sometimes, especially initially, without properly training your core muscles, you might end up hurting the spine rather than, like you said, counterproductive. So exercises, which I would say maybe three simple exercises which you could do on a daily, on a day-to-day basis, is lying down and lifting your legs up and down. These are basically simple exercises which anybody can do. Alternate leg raises. So this is something that actually strengthens your abdominal muscles, your core muscles, and back muscles. Other thing is, bridges. Maybe these are all technical terms. Maybe once you learn, people go to the gym, they actually are aware of these things. But bridges, pelvic exercises, these are the other things that we can do on, on day-to-day activities. Third thing is swimming. If somebody has access to a swimming pool and somebody is actually knows swimming, is one of the best exercises for the spine, which are actually very good because you're lying down, your weight is less. You're flat in the water, your weight is actually reduced, and you're flapping your legs, and you're using your hands. It's an exercise for the whole body, especially for the spine. But when can it become counterproductive? So like you said, people want to become fit fast.
They also want to lift extra with their ego sometimes.
Absolutely. They want to get, nowadays everybody wants things fast. You want to get into shape fast. You want to see results fast. So they tend to overdo things, especially if it's unsupervised. Many people in many apartments now have gyms, so people just hit the gym, see videos on YouTube or something like that, and start doing exercises on their own, not knowing what their limits are. So a good strengthening of your core muscles is very important before you actually start doing weights. Weight training is important, but probably it is, not to be done initially. And unsupervised. If you really want to do exercises, consult maybe a physiotherapist initially, or even do it under supervision of a proper gym trainer.
Okay, so maybe these exercises will help, keeping a good posture all the day. Consciously it will help. But there is a point wherein the back condition or the back pain grows a lot, and there's a point wherein I have to reach you. What is that point, the seriousness?
Yeah, correct. So back pain, every back pain is not serious, but some back pains can get serious. So simply put, any back pain or pain in your neck or any part of the spine, if it's not getting better on its own, while we do our day-to-day activities, we may pull a muscle, or we may develop some strains. But if it's not settling down just with simple over-the-counter medications, or if it's prolonging for more than a week or 10 days, I think that's number one, we should definitely not neglect, because it may develop into chronic pain, it may land up with some other problem. Second thing is, if a back pain which is radiating to the legs or arms, or neck pain coming to the arms, I think these are some things which are definitely not to be ignored. These are actually called red flags. So that is with pain along with numbness or tingling in the fingers or the legs, or pain that is shooting down the arm or the legs. So this means that there could be something more sinister going on inside, like for example a slip disc which is starting to compress the nerve. That's when people develop pain which radiates. So I think these are the red flags that we should not ignore. And if you do have such a symptom, definitely consult the spine specialist.
So after hearing all these symptoms, if someone whom I know is suffering from this and he comes to you, what is the first thing you would do as a surgeon?
When somebody does come with a back pain which is not settling down with simple medications, or the pain is radiating to the legs, and they've actually come to a spine surgeon to consult, so we would definitely investigate further. If it's just something simple which has lasted for a couple of days, we would still recommend maybe just simple treatment like medicines or exercises, physiotherapy. If the pain is acute, sometimes just rest, simple rest would actually be sufficient. But despite all these simple treatments, if the pain is not settling down, or patient is actually developing worsening symptoms like the numbness is increasing, or they're actually developing some weakness, it's not sufficient just to simply watch and wait. We would definitely investigate further. So the simplest investigations would be things like an X-ray, or the gold standard in these kind of symptoms is basically an MRI. An MRI of the spine will give us a complete picture of what is going on inside, whether there is a slip disc, whether there is a nerve compression, whether there is some other serious problem that's happening inside the spine. So that's called sciatica. So when we say sciatica, again, it's a very commonly used word. So sciatica means any pain from the back which is basically radiating to the leg. So that's the sciatic nerve, which is the longest nerve in the body. So that's coming all the way from the spine, going all the way down to the legs. So this is a symptom which is commonly experienced, but also commonly neglected, because most people think that it may just go away. But once it's actually detected and we find a cause, like for example, MRI shows that there is a slip disc, or sometimes there could be worse conditions like, maybe a tumor or something else, basically these are the common problems that we see when people neglect conditions and they actually come. So I really wish sometimes people don't neglect the symptoms and they actually come to the doctor earlier, because if it is detected earlier, the treatment also can be simple, rather than wait for something to become more complex, and then of course the treatment also becomes more complicated.
So where is the point where you get into the surgery, or you tell the patient that, yeah, you need a surgery?
Just because I'm a spine surgeon, I don't suggest surgery to everybody. In fact, 90% of the conditions probably will not require surgery. It is only those 10% of the conditions where surgery is actually indicated. So like I said, we always start with simple solutions. Like for example, medications. Most of the time problem is pain, so painkillers will solve the problem. But if the problem is more serious, if the compression is of the nerve is actually there and that needs to be released, that's when surgery is indicated. Like I said, the patients may have neurological deficits because of a nerve compression. They may have weakness or numbness in the legs, and that's something that should not be left alone for a long time. Sometimes physiotherapy and exercises can also help. Not that it will actually undo the problem, but it's just the body probably gets adjusted to it, or your nerve actually get used to the problem. So surgery is indicated only when all these conservative treatment fails. So it's actually, there is enough evidence to say that any treatment that is not getting relieved beyond 4 to 6 weeks of conservative treatment, that's when surgery is actually indicated.
Okay, that's where your expertise is, minimal invasive surgery. And I was trying to research about this term, and I could understand that this is a type of surgery wherein a patient gets least pain. That's what I could understand in layman terms. You could tell more about this specialization of yours, the expertise of yours.
So absolutely right. So gone are the days where, back in the 80s and 90s, spine surgery was thought to be very, very scary or very risky or unsafe. That's because it was all traditional open surgery. Not that it's bad. It's just that the technology was not advanced back then. Nowadays, minimal invasive spine surgery has come out, and that's coming up in a big way. That's because it's a technique. It's a technical advancement of the same conventional procedure. It's not like we're doing something new. We're doing the same surgery, but in a better way and a more advanced way. So what that essentially means is that we are using smaller incisions, to reach the spot and actually do the surgery. So nowadays, how is this done? Basically, we use advanced technology like endoscopes, we use microscopes, sometimes even highly advanced tubes, so that the muscle in the back is not actually damaged. In an open surgery, what happens? We have to actually physically cut open the muscles and actually separate the muscles to reach the bone. And then ultimately, if there is a disc prolapse or a nerve compression, we need to decompress that. So that is lot of collateral damage which need not be done. So minimally invasive spine surgery basically avoids all this collateral damage to the muscle, because muscle is actually important even after surgery for you to recover. So you need that muscle. If not for that, then the surgery is actually may not be so effective. So what minimally invasive surgery essentially does is that it preserves the back muscles, the posterior muscles which are there.
I do understand the minimal invasive surgery is technologically advanced, but still, if you would tell me about some benefits with respect to the normal surgery and this one.
Yeah, so conventional surgery, like I said, actually involves cutting open. So the first and most important thing that we are, comparison as compared to minimal invasive surgery as compared to open surgery is the blood loss. So we're not doing any damage to the muscles, so the blood loss is very much reduced. So there's reduced bleeding. Because it's a small incision, there's reduced bleeding. Obviously, there's going to be reduced pain as well. There will be some pain, whatever surgery that we're doing. It's not like unbearable pain. The next important thing, they can get up immediately. So early mobilization, that is compared to open surgery where patients would have to have bed rest and maybe prolonged recovery time, especially after surgery, just to recover from the incision and the damage that's actually gone inside. So minimal invasive surgery improves upon that. Patients get up the same day or the next day after surgery, and because there's a small scar, the wound heals fast and they're back to work quickly. So the recovery time, I would say, is one of the most important aspects, because like I said, our lifestyle today is we want everything fast. We want to get back to work fast. So I think minimal invasive surgery actually helps us achieve that in a much better way. So reduced blood loss, reduced pain, smaller incisions, quicker recovery, faster healing, patients are happy.
Also, Dr. Hari, while I was going through your profile, I saw that you've got fellowship for reducing radiation during the surgeries. What is this radiation during the surgeries and how is it different now with the technology?
Correct. So that's actually one of the most important aspects in terms of advancements that's happened over the years. So while minimally invasive technology was developed in the initial years, a lot of radiation was actually involved. So because nothing is open, we are just seeing the bare skin, and how do we go and reach the spot inside? So that's where a lot of x-rays needs to be taken. So that causes a lot of radiation. So one of the most important advancements in technology, and what we have in Aster also right now, is something called navigation technology. It's just like GPS. So how your car uses navigation. Nowadays, this three-dimensional imaging which is there, what we call as O-arm. So now Aster has basically this advanced technology called an O-arm, which takes like a CT-like picture, a three-dimensional picture of the patient's spinal anatomy. And that is basically transported to a computer, and that's basically used, the navigation, basically what that image is used, that patient's image is used as a reference, which will basically guide us through the entire procedure without actually having to open. So this way we are reducing the radiation to a large extent. Also, because nothing is open, we can't see any of the structures. Sometimes there is also fear that what something goes wrong. This way accuracy also is improved. So by using navigation, we know exactly at every point in time where the surgery is performed, which level we are, where is the disc, where is the nerve, where is the bone. Sometimes we use screws also sometimes to put inside the patient. Implants are there. So we will know exactly where the screw is going. So accuracy is actually improved, or rather to a large extent, almost like sub-millimeter accuracy.
So is it safe, and how fast or soon the patient can recover after the surgery?
Yeah, so I think that's basically hitting the biggest question mark patients still have. And I think it's a big problem we as spine surgeons still face, trying to convince patients even when surgery is actually necessary, and people neglect that because they fear the spine surgery. They feel that it's unsafe. So gone are the days, like I said, where spine surgery used to be considered unsafe. Nowadays, with these kind of advancements in technology, navigation technology, minimally invasive technology, endoscopes, microscopes, so safety profile is actually improved rather than getting worse over time. There's even another technology called neuro monitoring. That is, we use something called machines where all your nerves are actually monitored during surgery. So even though you're under anesthesia, you're not able to move any of your body parts, we still know how the nerves are working. Like how an ECG records the impulses of the heart, these machines actually record the impulses of the nerves, so that we know whether the nerve is working or not working, so that patients, the risk of paralysis and those kind of other fears that patients have are definitely not there anymore. So I think definitely spine surgery has really evolved over the years. It has become highly precise, safe, and definitely very, very accurate. So all this improves the patient outcomes. Yeah, and because of all these technologies, especially improvement in minimal invasive techniques, endoscopes, microscopes, using the smaller incisions, patients get back to work faster. They don't spend much time in the hospital anymore. There's no bed rest. Most of our patients get up and walk 24 hours, 48 hours of surgery, and they're even discharged in 1 or 2 days after the surgery. And maybe within a week, they're even able to get back to their normal lives. It's as simple as that nowadays.
I'm sure the technology is helping, but there are people like me who are scared of surgeries. And you have also come across, I'm sure, that those patients who are way scared of surgeries. Any example, or you remember anyone who's...
Now that you've mentioned it, there's this patient who came yesterday for a follow-up, post-surgery. I still remember this very clearly because she was a very young lady, 35 years, lady who was an IT professional, as usual in Bangalore. So the thing is, she was really, really scared. In fact, she had back pain. She's been having back pain probably for couple of years, and she had pain which was radiating to the legs. She had already consulted many doctors, and she had even done MRI which showed that there was a slip disc and nerve compression. Most of the doctors had actually suggested surgery, but she wanted to try conservative treatment, and she had tried. Everything had failed. When she came to me, I just had to tell her that, see, we can try conservative management, but your nerve is actually getting damaged. It's getting worse. She had weakness in her feet, and she had numbness, and at this point of time, I felt that surgery should not be delayed any longer, and I tried to tell her that. So what I just told her is that I can do a surgery which is going to be safe, which is going to be minimal invasive, which is going to be a very small scar. You can get back to work the next day. You can get back and get discharged the next day and get back to work in a week's time. And so this is what probably convinced her. She still was scared, but after the surgery was done, her pain completely got relieved the same day of surgery. She was so happy. The next day she was discharged. She was so happy. She was able to do all her daily activities, and she came back for follow-up 1 week later. That's yesterday. And she really had, she was extremely happy that she was relieved of the pain. She just wished she had done it earlier.
Okay, that sounds great. And I'm sure you're helping a lot of patients with your expertise. I mean, they come to consult you, but for our audience, what would you give some measures or tips for them to have a safe back throughout their life?
So probably the single most important advice I'd like to give everybody is that don't neglect your spine. So every year, we have these kind of spine health talks and spine health advices, and even the spine health awareness months. So the whole idea of all these kind of things is that people often neglect their spine. When it's any other organ, you don't tend to neglect that as much as you would neglect your spine. And every day we strain, because of our lifestyle, we tend to strain or load our spine in a very, very negative way. And that's not a good thing. So probably the single most important advice that I would want to give everybody is that if there is a pain that is not settling down, don't neglect it. Take consultation of a spine surgeon. And if there is a problem that needs to be solved, and if surgery is one of the treatments, it can be done in a safe and effective way, in a minimally invasive manner, so that patients can get back to their normal life much earlier. So probably I would like to say that take care of your spine, and your spine will take care of you.
Thank you so much, doctor, for your time and for the insightful conversation. And for our audience, please take care of your spine, and the spine will take care of you. Thank you so much for watching.